You want to know something I really hate? I really hate this. I hate to talk about fellow nurses, but I really hate this because I'm a travel nurse. I travel around the country and I still see things that shock me. For example, ADHD. Everybody got ADHD. People, mama has it, baby daddy has it, doctors, nurses have it, surgeons have it, my cat might have it. But for some reason, all those people know about ADHD or have ADHD. Those same nurses act like they don't know the basic side effects. And that's what's shocking to me. I work on a kid unit one day, most days, and the kids complaining about hunger or they don't want to take the medicine because their stomach hurt, which the basic side effects is the stimulant is an appetite suppressant. And what happens when this wears off, the kid or the patient will feel like they're starving. So they just not behaving trying to get free snacks. They actually feel like they're starving. You know, that's just basic Adderalls, Vyvanse, Ritalin. Then they got the non-stimulant medication also, for like Concerta. So when you working with this type of population, you should basically know your population. And also you got to do the assessment. If you're there with the kid in the morning, ask the kid how do the medication make them feel. Does it mess up their stomach? Does it give them a headache? Does it make their mood fluctuate, which is another basic side effects? We need to know this information so we can tell the doctors, make sure the charge nurse have enough snacks. And sometimes we have to bend the protocol because a lot of behavior hospitals, they want to correct the behavior of the adolescents, right? So one of the things they try to do is withhold snacks. They know they got to feed them, but they can withhold snacks sometimes, which when I come in, really pisses me off because I got teenagers. A teenager eat you out of house or home with no ADHD, right? So we give these kids the medication that increase their hunger, but then we withhold the snacks. What I mean by withholding snacks, I'm talking about the scheduled snacks. Yeah, the hospital has scheduled snacks, but sometimes you got to bend the rules a little bit. Yes, you don't want to give them the sugary snacks, which make them fat, which lead to diabetes. However, apple, banana, oranges, you can give them fruit to satisfy their hunger. Because if not, we just put them in a torture chamber. I'm giving you this medication. This medication affecting you. You're not doing anything to remedy this side effect because you're going to be there short term in the facility. So what I do, I assess the nurse, hey, how long you been a nurse? I've been there 20 years. 20 years. Do you know side effects of ADHD? Yeah, well, the kid needs a snack. It's not snack time. Well, this kid said something bad to me or inappropriate to me yesterday, so I'm doing a bare minimum. Yeah, but the kid is 6'5", 300 pounds. What if the kid get out of you? Like some basic stuff, I try to train other nurses, but sometimes it doesn't work because it's turned into a pissing match with the patients. If we giving a patient medication that suppress their hunger or increase their hunger because they're gonna gain weight on it too, a lot of them gain weight on it. We have to satisfy. We have to have what do we call it? Professional word. My mind went blank because I just do it automatic. What we call it? Give me the eye. What it give me the eye? Eye, right? Intervention. Give something, it causes this intervention, then we reassess the patient. Your assessment of the patient is the best tool you're gonna have on it. Because once you get the information in, then you can help the patient. If the patient come to the hospital because their mood's fluctuating, you know, ADHD medicine can fluctuate their medication, can fluctuate their mind, their mood. You have to pass this on to the parents, to the nurses, and also the doctors, right? And also, sometimes you have to break the rules. If you have a patient that is suffering and you got to be the patient advocate, meaning by patient advocate, meaning that you have to do what you have to do for your patient. That's about it. Catch me on Mind with Stevenson on Facebook, YouTube, X, Twitter, all that stuff. That's about it. Okay.